My name is Dr. Chudi Ufondu of SNOWSPIRATIONS Global Health Solutions. Today is the 14th day of May 2021, and today is a great day. Today is our popular 40s Fridays clinic. And in the next few minutes, we're going to have an opportunity to talk about this IVF, IUI, all the talk about IVF and IUI. Now, it will be a very good opportunity for you to actually know what IVF is all about and also know what IUI is all about. Today is 40s Fridays. 40s Fridays in our clinic is very important. You see, our group is made up of so many people. We have so many people with different problems, with different prospects, with different things they are believing for. And of all the population in our group, women about the age 40s are very, very important to us. Now, we actually downgraded it to 35 because by the time you get to 35, you are actually considered advanced in maternal age. So today's topic is going to focus on IUI versus IVF. What's IUI? What's IVF? Who is qualified to go for both of them? Why do we even have it in the first place? What's the relevance of IUI and IVF to our women who are in advanced maternal age? So why do we need to talk about IVF and IUI among women who are believing God to become mothers from 35 years and above? Now, it's very important you pay attention to me this afternoon because the knowledge you're going to gain today can change your attitude. And if your attitude is changed, you can change your perception. If your perception is changed, you can change your practices. If you change your practices, you will defeat infertility. Remember, we have a common enemy. You have infertility as your common enemy. It's my common enemy. So I want to defeat infertility. You want to defeat infertility. You want to have a baby. I want you to have your baby. So we are on the same side. Now, what you need to do for me when you come in, let me know who you are. So introduce yourself. Tell me your name. Tell me your location. Your location is very important because we need to make sure we have enough resources in your location, especially if you're in Nigeria, you have an advantage. Of all the members in our group, Nigerians, we have great advantage, especially if you're in Lagos, if you're in Abuja, if you're in Enugu, if you're in Awka, if you're in Nnewi, if you're in Osun State, if you're in Port Harcourt, if you're in Owerri, if you're in Asaba, if you're in Kano, if you're in Lokoja, you have an advantage because we can set you up to go and meet a doctor one-on-one who can evaluate and find what the problem is. So let me know your location. As soon as we're done doing that, I will start taking care of your questions. Okay? So thank you for coming this afternoon. I truly appreciate you. I normally love counting down to 50. Once I have the number 50, I will start the clinic. So what we're going to talk about today is the concept of intrauterine insemination, which is what IUI is all about. Then in vitro fertilization. Now, please listen to me. It's possible they've given you this option as the only option that will make you a mother, but you might not really understand it. Or it's possible you've gone for IUI, it's failed 3 times. Now, what do you do? Or it's possible you don't really understand the concept of IVF, or probably you feel it's something evil, or so many people told you a lot of things and you don't understand it. This is your opportunity to ask all your questions. In the next 45 minutes, I'm going to interact with you guys. And my prayer is that after today's event, you will make up your mind. You will take your bold step. Now, coincidentally, for the month of May is a month of multiples. So I have about 42 people currently attending. So I'm looking for more numbers before I start. Now, this is what I know. By this time, 2022, we are going to have so many twin mothers. We are going to have so many triplet mothers. We are going to have so many quadruplet mothers. It will happen. Now, the bulk of women who will have multiple pregnancy will be dependent on the women that will go for either IUI or IVF. Some women are going to have multiple pregnancy naturally. If you have the predisposing factors, if you have an enabling factors, you can have multiple pregnancy if it's in your maternal lineage. But if you don't have multiple pregnancy history, you can become pregnant with more than one baby by accepting IUI, by accepting IVF. You can. So many women in their 40s, they might have been looking for babies for a very long time. And these are actually the best people in our group. I don't like stratifying, but women older in our group are more matured. They're very user-friendly. They've seen life. They don't come into the group to fight. They follow instructions. They want results. So I anticipate that if you're attending my clinic today, you are looking for solutions. And I'm telling you, you're going to get solutions, okay? So let's actually start. We don't really have much time, so we can get a lot of things covered. So when you hear about IUI, what do you actually understand about IUI? So IUI stands for Intrauterine Insemination. It's also called artificial insemination. It's a very simple procedure which can be carried out in the doctor's office. So it's a procedure we can carry out in the doctor's office. So the doctor simply will place a sample of sperm, which ahead on time, we would have considered that the sperm is of good quality. So you see, when you're having problems having a baby, it's not just the woman. We also want to know what's going on with the sperm. So for IUI, we need the sperm from the man. Matter of fact, most people that go for IUI have sperm issues. So IUI is predominantly used for men that have low sperm count, poor this, poor that. That's the people that prefer IUI. Now, between IUI and IVF, IUI is commonly used. IUI is cheaper. IUI is easier. So there are so many people that might have tried IUIs and probably it worked or it didn't work. So during IUI, a doctor will collect a washed sample of the sperm, and previously we've checked, we've made sure the sperm is okay. Then we put it inside the uterine cavity using a special catheter. Remember that your uterine cavity is your womb cavity. So anywhere you see uterine, replace it with your womb. So during IUI, we would have checked the guy's sperm ahead on time. He would have passed the test. For a man to qualify for IUI, you have to have good looking sperm, which is called the morphology. You have to have more sperm that have head, middle piece, and a tail. Then you have to have forward moving sperm. So that's motility. Then you also have to have enough number. Now, per ejaculate, a male can have millions of sperm. So when you qualify, we will give you an appointment with your partner. When we are giving you an appointment, we're going to make sure we have a good size catheter, which we're going to use to introduce the sperm right into the womb. Now, in IUI, it's normally performed two ways. So we can use the woman's natural ovulation cycle. So if it's confirmed that the woman is ovulating, then we can use that. What we need to do is to use ovulation test kits. If we have very high, possibility that the woman is going to ovulate, and for you to know that you're going to ovulate, you have to be younger. You have to have a regular cycle. So if we pinpoint when you're likely going to ovulate, you can have natural IUI. So in natural IUI, we're not going to give you any drugs. We're just going to target the time you are ovulating. Then we introduce the sperm with the catheter and we drop it on the higher end of the uterine cavity. Then once it's dropped there, it will begin the journey. So the essence of IUI is to aid the penis. It's to take over the function of the penis. Then the catheter will become the penis and deposit the sperm directly. When you're depositing the sperm directly in IUI, what are you doing? You're now bypassing the vagina. You're bypassing the cervix. You're going directly inside the womb. You're making it closer so that once it gets to the womb, it will begin to find its way to the tube. So one of the criteria for IUI is what? At least one open tube. This is very important. So my sister, if you were told your tubes are blocked, we need to confirm that. Please listen to me. If your tubes are blocked, you're not a candidate for IUI because there are things that must be standardized before you're going for IUI. You must have X. You must have very good cervix. You must have a tube, then the sperm. So if your tube is not blocked, it's going to be a wasteful venture. So your tube, at least one needs to be open. That's if you're going for natural IUI. Now, in medically fertility drug aided IUI, what do? We are going to give the woman fertility drugs that will go and induce the ovaries to produce a lot of eggs, which Clomid is a good example. So we're going to give the woman ovulation induction drug. So about the time we confirm that the woman is ovulating, we introduce the sperm. This is simply what IUI is all about. So if you don't understand this, this is the simplest way to understand this. Once the sperm is placed higher in the womb cavity, it will bypass the cervix. It will begin to take a trip to a special place in the tube called the ampulla. The ampulla is where fertilization will occur. So by the time the sperm comes in, and by the grace of God, you've released your eggs, when both of them meet, they will form an embryo. This is very important. Now, on the other hand, when we talk about IVF, what do you understand about IVF? IVF simply stands for in vitro fertilization. So the difference between IUI and IVF is the location of trying to help someone to become pregnant. In IVF, is outside the body of the woman. That's why it's called in vitro fertilization, in the lab fertilization. Whereas in IUI, it's called in vivo fertilization, inside the womb fertilization. So in IVF, what do? It's also a special treatment. IVF is superior to IUI, so it's a type of assisted reproductive technique. But we use the same thing. We need the eggs, we need the sperm, but the difference is it's going to now be outside the body of the woman. So before the fertilization can take place, would have checked the woman, would have confirmed your ovulation, would have checked the man, would have confirmed the man has good sperm. So what do? We combine both of them outside the body of the woman in a special lab. Then the union of the egg and the sperm will lead to an embryo. Now, when we are sure fertilization has occurred and we are comfortable with the quality of the embryo, what do? We introduce it back into the womb. It's called embryo transfer. Now, before then, we would have given the woman a lot of injections, a lot of medications to prime the ovaries to give us a lot of eggs. So the difference between natural ability to become pregnant compared to assisted reproductive technique, we are gonna challenge the ovaries to give us a whole lot of eggs. Whereas in your natural ovulation, you are supposed to release one egg. But if you're going for IVF, we will give you ovulation induction drugs and we will collect all the eggs from that cycle. Some people can collect 20, some people can collect 30, some people can collect 10, depending on how your whole body mechanism is. The younger you are, the more eggs you have. So for women attending this clinic today, listen to me carefully. This is a reality. This is your reality. You cannot stop aging. So you have to first of all accept that you're 35 years and above. You have to first of all accept that you are now classified as advanced. Now, the next thing you have to ask yourself, what are my options? So in this group, your options of becoming a mother, of joining the League of Multiple Pregnant Mothers, twins, triplets, quadruplets, is to accept that you might be a candidate that will go for IUI, that you might be a candidate that will go for IVF. So you have to accept. Now, what's the difference between IVF and IUI? The key difference is the fact that in IUI, fertilization occurs internally, but in IVF fertilization occurs where in the lab. Okay, so I've already explained the techniques. This is the major difference in IVF and IUI. So in IUI, everything happens inside the body of the woman, in the womb. But in IVF, everything happens outside the body of the woman. Then when we are successful, we begin to introduce it back into the womb. Now, what's the commonality? We need the eggs. We need the sperm. We need the cover of the womb to be okay. We need the tube. But if you are going for IVF, you don't necessarily need the tube. But at the end of the day, the common denominator between IUI and IVF is what? Fertilization and implantation. So when you succeed in allowing the sperm, which you kept in the womb, to travel to the womb, to travel to the tube, and succeed in meeting the egg there. When that happens, you are pregnant. Now, when pregnancy is confirmed, the journey has to start from the tube to come down and start developing in the womb. That's called implantation. In IVF, once we confirm that there is a union between the egg and the sperm, an embryo has formed, and we have transferred it back into the body of the woman, and after 14 days, you get a positive pregnancy test, there is no difference. Both naturally conceived pregnancy, both IUI pregnancy, and both IVF pregnancy, once pregnancy test is confirmed positive, everybody becomes equal. There is no difference. The only difference is in the process of getting you pregnant. So there are so many ways you can become pregnant, except the natural means. Now, if everybody is becoming pregnant, we won't even have this group. But you are currently having challenge. So it's possible you have been trying by yourself, you're not succeeding, but this is the moment we've been talking about. If you are not succeeding naturally, please escalate. Don't waste time. Why is it important to escalate? Because as a woman, your eggs are perishable. Once you exhaust your eggs, you enter menopause. Majority of women in their 40s are already struggling with what we call low ovarian egg reserve. So you no longer have quality eggs that will aid you to become pregnant. So if you are going for IVF and you're 40, please have a very broad spectrum open mind to accept donor eggs. Once we check and your eggs are not of good quality, please don't tell me about, oh, let me try. There is nothing like trying. We want results. So I wouldn't want you to waste the whole of 2021 doing something that will fail. No. So long as you have good eggs, I don't have problems with that. But if your eggs are compromised, then please consider using donor eggs. Remember this. So these are the few things you have to be conversant with. You have to have at the back of your mind if you're getting ready to get for this. Very, very important. So remember, not every woman will qualify for both. The only people that will qualify for IUI are the people that other fertility investigations and other fertility treatment did not yield results. So if you're having problem and you've gone to see a fertility specialist and we've given you a couple of treatments and you're not getting good outcome, what do? You step up. So IUI is a step up. IVF is also another step up. So some people can go for IUI. What I preach is if you've had 3 failed IUIs, escalate to IVF. Now, your chances of succeeding in the both procedure is dependent on a couple of factors. On top of the factor is your age. Age is the biggest factor that will lead to either success or failure of IUI or IVF. Now, if you are younger, you don't even have a need for the two. Now, remember that 35 is the cutoff point. I know you might not like this, right? I'm not saying this to make you afraid or to cry. I'm saying this so you will know. When a woman gets to age 35, she is classified as advanced in maternal age. You are advanced. You need help. So that means if you are looking for a baby and you're 36, and you don't have a baby, at the end of 6 months, you have to escalate. You have to step up. You have to see a fertility specialist. You need to begin to try things differently. But if you are younger than 35, you have a whole 12 months, which is a year, to try and go for your own baby. Once you enter the 13th month, change your game plan. So the biggest factor that will lead to success, increase in the probability of having good outcome in IVF or IUI is your age. So women younger than 35 have approximately 50-50 chance of becoming pregnant immediately they go for their IVF. Now, you might succeed the first time. Okay? It's 50-50. The second time, you might succeed. The third time, you can succeed. But guess what? Generally, among all women, the more they go, the more they have a chance to succeed. So it's not guaranteed that, oh, once you go for IVF, miracle will begin to happen. But you have to take your chance, especially if you're older. So if you're 45, you have to start running around and you don't have time to be, going up and down. You have to start doing it. It's not I'm coming, I'm going. You have to start. If you're in this group, as I'm talking to you, you're 35, and you've been on BFB category since 2020, my sister, you need to escalate. We do not have that liberty of, oh, I'm coming, I'm going. Oh, let me think about. You don't even have time to think about this. Look, I'm telling you my truth. Now, remember that everything I'm talking about is also in addition to your PPP. So whether you're 50, whether you're 60, whether they gave you all the diagnosis in the world, it's still not supposed to stop you from PPP. So you have to make love 48 hourly. In addition to waiting, we have had so many people that were waiting for IVF and suddenly they become pregnant. That's where God can come in. But you need to be in the arena of getting pregnant. You cannot be outside the arena of getting pregnant and you become pregnant. You cannot leave your house and live in the church and not meet with your partner and you can become pregnant. No, you cannot go and pray down the whole world and you're not taking action and you become pregnant. No, you cannot. The only way for you to become pregnant is to be in the arena of pregnancy. And what's the arena of pregnancy? You must engage your partner 48 hourly, regardless of what your diagnosis is. So admin, capture this. Regardless of what they told you you have, whether it's male factor, female factor, it doesn't matter. Keep on making love. Don't stop your love making. I'm going to give you a couple of statistics so that you will feel what I'm trying to talk about. If you are under 35, you're going for IVF. You have a 55% chance of having good outcome in your IVF. Now, if you are 35 to 37, you have 40% chance. If you are 38 to 40, you have 28% chance. If you are 40 to 42, 13%. If you are age 42 above, 4%. So what can you notice? The older you get, the more difficult it becomes. So you need to take action as I'm talking to you today. Remember, whatever I'm telling you is for teaching purposes. So I'm not trying to discourage you. I'm telling you what I know. This is evidence-based. What I want you to do today is to begin to do something. So many people say, but Doc, I don't understand it. I'm going to open the floor soon. Then you're going to ask me my question. So please, think about everything I've told you about this afternoon. You can become a mother of 2. You can become a mother of 3. You can become a mother of 4 at a sitting. You have a big advantage because for some reasons, this is where God is bigger than anybody. For some reasons, God knew that women are going to have reduced ovarian reserve, right? Now, God gave those women that are older the opportunity for the eggs to divide or to produce more than one eggs. So women in their 40s can easily have twins, can easily have triplets, can easily have quadruplets if they go for IVF, if they go through natural means, compared to women that are younger. So the fact you're getting older might be a disadvantage, but the fact you're older might be an advantage in regards to having multiple pregnancy. This is one of the few things we're going to teach you during the class. So please, if you haven't registered for the round table, so the round table is our super masterclass. Anytime you see super in any of my master classes, you can take it to the bank. You have to go and register for that event. We only have 100 slots. And I think about now we have about 50% sold off. So register. Come, let's fellowship. You might not be a mother in 2021, but you can be a mother in 2022. And God can give you 2. God can give you 3. God can give you 4. It has happened before. This is not tales by moonlight. Whatever I'm telling you is evidence-based. So you need to take your chance in as much as you're older, because you can suddenly have 2. You can suddenly have 3. You can suddenly have 4. A few days ago, I posted the picture of the Octomom. It's not fluke. It's not Big Brother Africa. This is reality. Take your chance. Now, what are the other factors that can lead to successes when you're going for IVF? The patient selection, your ability to use your natural potentials. So this is where age will come in. So the younger you are, the more the likelihood you're going to have good opportunity. But it doesn't mean that if you're older, you're not going to have good opportunity. So it kind of cancels out. Now, your diagnosis. So diagnosis means what caused that infertility in the first place. If the problem is not coming from you, then you can become pregnant. So we need to know the diagnosis. We need to know the extent. Some women, unfortunately, might have some diagnoses that badly damage their womb. Remember, for you to carry your baby to 6 months, you have to have good endometrium. So if you have endometriosis or fibroid and they badly damage your body and you have hormone imbalance all over the place, we can go for the best IVF and you will still fail. So we need to fix everything fixable before you proceed. Now, there are different types of protocols. There are short protocol, there are intermediate protocol, then there are long protocols. So these are types of IVFs. So we don't just have baseline IVF. There are some standardized advanced IVF. Like some people can go for what we call intracytoplasmic sperm injection. So what do? We wash the sperm, we put it in a string, then we inject it directly into the nucleus of the egg. It's a more superior type of IVF. It's more expensive, but it's more guaranteed to give you success. So your individual factor, your diagnosis, the protocol used. So this is where you need to have conversation with your IVF provider. You don't just go to anybody and say, oh, I'm providing IVF, and you don't ask questions. You have to book appointment, both of you, both the males and the female. You have to go, koro. You have paid your money. You begin to ask your questions. Every single concerns you have, ask. It's your duty. Now, when you're done asking questions, they have to give you the protocol formal. They have to give you exactly what they are planning to do. You have to have it in a document and you go home and you observe it because you're going to be giving yourself a lot of injections. This is where so many people are not getting it right. You cannot go to any IVF provider and they didn't give you protocol and they didn't give you the schedule. They didn't give you the timetable. It's not right. And commonly I see women that go, oh, doc, I've done 5 IVFs. Where's the report? Where is in the hospital record? What is he doing there? This is your right. So demand it. Now, the amount of ovarian stimulation. Remember that the first thing we do before we go into IVF is what? Ovarian stimulation. So we stimulate the ovaries to give us the eggs. The eggs are already there. We're just stimulating the ovaries to give us the eggs. So the amount of ovarian stimulation, the couple of cocktail of drugs we are using will determine part of the outcome. Now listen to this one, the 5th point, laboratory quality. Now listen to me carefully. If you're in Lagos, the difference between different places you can have IVF might be 200,000. It might be 100,000. Now, the quality of the lab, it's very important. The quality of the place you went for seminal fluid analysis is very important. The quality of the place you're going to go for ovarian egg reserve, your hormonal test is very important. Why is it important? If you go to a very poor lab, they will give you poor outcome and you will have false hopes. So if you warrant you paying that extra 100,000, extra 200,000, but you're getting result, please go there. Quality above quantity. If you have to do IVF, please go to the right place. Don't go to a place that will discount it because at the end of the day, it's going to fail. So the quality of the lab is very important. Very, very important. Now, there are a couple of things we add on in the techniques. So there are a couple of things so many IVF providers can do depending on your age. Like elderly women, there are a couple of different things we give them to give them more room to have good outcome. Please go above and beyond. Go to a provider that have results. Don't be the guinea pig. Don't be the first person they will use for experiment. Go to a place you can have meaningful conversations. You can ask them, Doc, thank you so much. My mind is with you. But how many successful IVFs have you guys done? If they refuse to tell you, that's not a good doctor. A good doctor will respond to this question because medical practice is evidence-based. So if they tell you they've done 20 and they've succeeded in 10, that's a good place. If they told you that they've done 200 and they've succeeded in 90, that's a good place. But if they told you they've done 10 and they succeeded in 2, that's not a good place. So you have to ask your questions. You cannot afford not to ask questions. So quality is important. Now, the number of embryo transfer. Remember, there are some women that can only have 1 baby. There are some women that can carry 2 babies, 3. So it's not every woman that can have multiple pregnancies. Some women might have incompetent cervix. Some women might have some problems. Some women, unfortunately, might not even be able to carry their own baby. They have to look for surrogacy. So the number and quality and the number of embryos transferred can also give us an inkling. Now, the sperm factor, definitely you have to have good sperm. Definitely you have to have good body weight. Definitely you have to have very good hormones. Definitely you have to have good lifestyle. So if you're getting ready for IVF, you have to be careful what you eat. You have to avoid stress. So many people stay up late night, crying, doing this, doing that. If you are stressing, your IVF is even gonna fail before you start. So you don't need stress. You need to talk to yourself. You need to tell yourself, you know what? I'm done with this. I'm gonna start doing things differently. These are the things you need to be conversant with if you are going for any of the two procedures. So it's very difficult to compare a couple of things, but please discuss the pregnancy rates with any clinic you choose. There are a couple of limiting factors in IVF and stuff, which you can't change. You can't change your ovarian reserve. You can't change your age. You can only be your age. So once age is not on your side, use other things. Even women that have gone into menopause can still become mothers. But what do you do when you enter menopause? Donor eggs. Even men that no longer have sperm. Unfortunately, there are some men. They can have all the erection in the world. They can be taking you to cloud nine. They might be the best lover, but there is no longer sperm in their semen. They have azoospermia. You need help. Okay? That's my presentation this afternoon. And some people use donor eggs, okay? So if donor eggs and donor sperm is your opportunity, please use them. Okay? So thank you for listening to me. Now the clinic is going to open in the next 15 minutes. I'm going to take care of your questions. So if you have questions, please go ahead and ask your questions right now, and I'm going to attend to you. If you know anybody having problems with infertility, the best gift you can give them is a membership of this group. So share the group, tell them to come in. We love them. We want them to succeed. So my prayer is that everybody that wants to be a mother, a father, can be a mother and a father. Guys, go ahead and ask your questions. The clinic is now open. I'm ready to take care of your questions. If you are not really understanding the concept of IUI before now, this is your opportunity. What can cause bleeding? Okay. How long does induction ovulation? It depends on the protocol. So if they're using short protocol, that means short-term IVF or medium-term IVF or long-term IVF. Everything is dependent on how your body responded. Okay? Please explain the sperm. Please make sure your questions are very brief, because if you put up, extensive question, it's going to go up my screen. Okay. What can cause bleeding after days of IUI? Anytime you have bleeding issues, it can be infection, it can be inflammation, it can be allergies. So what you need to do is to go back to your doctor. Okay. Go back to the gynecologist. What's the name? What's the successful rate? So the successful rate is something you ask with your provider. But at 36, you have 1 year above 35. So the older you are, the lesser the success rate. It doesn't mean you're not going to succeed, but it becomes more difficult the older you are. So if you're 36, if you're in that, cut-off point, you need to do something different. Okay? Guys, keep asking your questions. Unfortunately, the questions are coming so fast. So the ones I see on my screen, I'll provide feedbacks. Okay, so guys, keep asking your questions in the next 15 minutes. I'm going to give you feedbacks. Ask your questions. Ask your questions. If you need to consult with me, very, very, very possible. You can start with 1 week. You can come at 1 month. You can come at 3 months. Then you can come at 6 months. 6 months is the cutoff point. Dr. Ndiche is in the clinic. Dr. Ndiche, please, any question I missed, provide feedbacks to them. Men are also welcome to ask questions. I love men that attend my clinics, because most men do not take infertility serious. Most men abandon their wives, their whatever, to go and, woman, don't bother me. The problem is coming from you. So whenever I see men attending, I'm very happy. A friend complained of pain around her navel and she's pregnant. I hope that your friend is attending ANC clinic, right? Every singular pregnant woman must have a doctor attached to them. You must register for ANC. Any pain in pregnancy is something we need to investigate. So I hope your friend is attending. Okay, someone is asking about COVID. Good evening. Can someone trying to go for IVF take COVID vaccine? Why not? You have to take it. There is no research that said you can take it. Even some pregnant women can take it. Guess what? In America now, if you're fully vaccinated, you can walk around. But if you're not vaccinated, you're still at risk. So if you're planning to go for IVF, you want to be alive, right? You don't want to get this nasty virus. So go and take your vaccine, my dear. Okay, that's no problem. I've taken my family, everybody, they've taken theirs and we're covered. Okay, we're still standing. We haven't disappeared. So be careful what you read out there. Vaccine protects. The reason why the world is still, existing, people are still going about their business is because of the vaccine. Imagine what could have happened if you don't have the vaccine. Okay, so guys, keep asking your questions. Keep asking your questions. Let me see what I can glean from here. Okay. Now, admin, you can post the states we have referral services. But here's the deal. Even if it's not in your state, you can travel from Anambra to Enugu. It doesn't matter. You can travel from Port Harcourt to Lagos. Anywhere you're going to get results, just go for it. Is HSG test painful process, and what's really involved in HSG? Now, this is where so many people make mistakes, right? Your friend might have a low pain threshold or high pain threshold, then they go for their HSG, they begin to confuse you, they begin to put fear in you. Now, listen to me carefully. HSG stands for hysterosalpingogram. It's a special test every singular woman who is having infertility problem must go for. HSG is a test we use in checking if your tubes are open or not. There is no other way for us to check it. So you have to go through it. Now, is it painful? Is it sweet? Definitely. It's not like they are calling you to put sugar in your body. It's going to be uncomfortable. In some places, you're going for it, we give you some painkillers. But it's a necessary test you have to go through. But the theory about, it's painful, I can't stand it, then you're not ready. That means you can't even go for labor. Labor is hell. But guess what? When you are pregnant and you're anticipating that your baby is coming, you don't even care about the pain. I remember when I was, in Nigeria, giving a episiotomy, the woman will not even know you're cutting them. Why? Because their baby is there. Nothing compares to your baby. Once your baby comes, there is no pain. So my people, the world of women is all about pain. Don't lose the opportunity of doing what you need to do because of the rumors of what your friends are telling you. They are your friends. You are you. Your pain threshold is entirely different. So you need to go and do what you need to do. So you stop wasting time. Okay? The questions are coming in drones. So let me see. Okay. Can somebody bleed after IUI and still be pregnant? Yes. Sometimes you can have spotting. You can bleed. So the fact you're bleeding in pregnancy doesn't mean you're going to lose that pregnancy. But you need to present yourself to your gynecologist immediately. Majority, 25% of pregnant women bled and they still had their baby. But the most important thing is to understand that anytime you see bleeding in pregnancy is a danger sign. We must investigate. That bleeding might be dehydration. That bleeding might be implantation. That bleeding might be a sign you're losing the pregnancy. So what do? You go to the hospital. There is no time for guesswork. Every singular pregnant woman, there are 3 things you must be conversant with. Bleeding, water coming out of your body, and pain. Anytime you experience any spotting, you went to pee and you saw little spotting, call your doctor, run to the hospital. Anytime you notice any pain, run to the hospital. Anytime you didn't pee and you notice that water is coming out from your vagina, it's possible you're about to lose your baby, run to the clinic. These are the 3 things you have to be conversant with, okay? So my sister, just go for your HSG. It's just a necessary test you have to do, okay? The best fertility clinics in Nigeria to avoid scam centers, well, it's possible you're just coming here for the first time, right? So we don't give you things we are not sure of. If you notice, I'm a very, very proactive, forceful person. So if I'm sending you to a provider, we can interact, right? So anywhere I'm sending you to, I have a bridge, I can interact with them, right? So we go for few. If you notice, there are so many places I don't know people. Some people will come, I've gone to this place, if I don't know them, I don't know them. Because if you're under me, it's my responsibility to give you the best. So if I'm referring you anywhere, definitely is verified, definitely is certified, definitely they have results. Like our provider in Abuja, he's recorded a couple of amazing success stories in multiple pregnancies. At least 3 quadruplets, 3-4 babies that are sitting in Nigeria. So there are so many amazing people doing amazing things in Nigeria. Okay, so if you don't go beyond your doubts, your doubting zone, oh, this person told me, oh, that person told me. And especially when it comes to resources. Unfortunately, infertility is expensive. So the first thing I will tell you, if you're keen to vacate infertility world, take your bold step. Subscribe. Come in for 1 week. Come in for 1 month. Come in for 3 months. Come in for 6 months. Attend the event coming up. Learn, use the knowledge. Tell your partner, share this video. Tell him, hey, come, listen to Dr. Chudi. We can even talk to you guys as couples, especially if you're above 35. I don't joke with women above 35. Why? Because you don't have much opportunities. And it doesn't matter where you reside in the world. Now, it's possible you're already under me. Remember, the onus is on you. So you need help, you come to me. If you are already subscribed, make sure you use your services before it expires. When it expires, you have to renew. So I don't care if you're in Spain, I don't care if you're in Germany, I don't care if you're in Canada, it doesn't matter. We can crush this with knowledge. What I'm here to share with you is knowledge. It's hope. It's faith. It's telling you can become. It's waking up that motherly instinct in you. I'm not here for rumors. I'm not here for negatives. I'm here to tell you that you're going to be a mother next year. So I'm not bullied. But you must take your bold step. So many of you are warming up to spend 2020, 2021 the way you spent 2020. No. If you do what you did in the past that didn't give you a result, you will still get the same outcome. And you're going to be 1 year older. So you're tending towards your menopause. This is a reality. I'm not saying this to make you feel bad. Look, I love you. You know that already, right? Now, some people might be 6 months to menopause. Some people might be one year to menopause. Some people might be two years to menopause. Now, by the time you tell me you're coming, let's pray, let's fast, by the time you come back, you might have entered menopause. And if you have entered menopause, what else do you need? Donor X. And some of you cannot even use Donor X. Rather, you prefer to be alone and die. But God didn't make you to be alone. When God gave you your breast, God gave you your breast because you have to breastfeed your baby. When God gave you your womb, God gave you your womb because you have to carry your baby. So God didn't make anybody to be alone. When God created Adam, God made Eve. So anybody that came together in marriage should have their babies. But some of us are wasting time. And there are so many people that are enabling us to waste time. Some of them might be your pastors. There are some good pastors, very good pastors, but there are some bad pastors. There are some of them that attach a lot of importance to money. Oh, bring big money and I'll pray big prayers for you. Bring this money and I'll bring maternal cause. I'll do this. It's all about the Benjamins. It's all about the money. Go and use that money and start something. Stop allowing people use your problems to make fortunes. Break the backbone of this infertility. Employ your services, employ the resources. If God gave you the money, go for it. Go. This is May. The reason why we chose, I have 3 more minutes. Admin, please notify me. So if your questions are not answered, don't worry, tomorrow I'll come for the word round. Now, listen to me. You don't have time. This is May. The reason why we chose multiple pregnancy for May, can someone tell me why? Because after May comes June, right? By June, we start counting down. In May, you've had, by the grace of God, you've ovulated in January, you've ovulated in February, you've ovulated in March, you've ovulated in April, you're ovulating in May. 5 chances of becoming a mother. Now, by the time we enter May, the next month is June. Count down to the last 6 months. What will be your scorecard? By December, what will be your scorecard? By 2022, listen to me. When I show up in this group on the 14th of May, 2022, it's going to be a glorious day. I just want to be seeing all the babies and all the happy mothers. I don't want you showing up in 2022, my sister. Do you understand that? I don't want you showing up as someone still looking for a baby. You can't keep looking for a baby. I want you to have it. Have that baby. By any means. Legal. If you have to adopt, adopt. If you have to go for IUI, go for it. IVF, go for it. But do something. Especially as you're looking at the chaos all over the world. Do something. Get back your joy. You can become. So please, if you haven't registered for the multiple pregnancy, I've noticed a trend. Majority of some of our members are committed. Like if you ask me now, genuinely, before God and man, How many people in our group are really, really committed? I can't boast of 1,000. That's my reality. You know, there are some people that come in, they think we are joking here. And look, your level of faith can set you free or keep you in the same place. If you don't have faith and confidence in what I'm telling you, then how can you believe that I'm believing that you're going to be a mother? Because I'm already seeing you like a mother. That's why I show up. So activate your faith. Do something. Come in. Let's go. We don't have much opportunity. So register for the multiple pregnancy. Let's end this infertility in grand style. Let's beat the hell out of this infertility. Let's look infertility eyeball to eyeball and say, you can't stop me. Reclaim your joy, reclaim your confidence, reclaim your happiness. Be the happy person that God made. Call forth your babies. Name them. Nothing can stop you. Without faith, you can't be a mother. Stop showing up and letting people beat you up, calling you names, your mother-in-law, your husband, your siblings. They've ostracized you because you don't have a baby. You are not defined by your status. You are the daughter of Most High God. So stop that crying today. Do something different. Get back your life. You didn't make yourself. Some of you are even contemplating taking your life. Aren't you a coward? You didn't make your life. Don't allow anybody make you inferior, whether you have a baby today or not. You are a mother until proven otherwise. If you have to adopt, go and adopt them. They will be the same baby. There is no difference. There is absolutely no difference. Thank you for coming. Please do the right things. Hopefully you will see me tomorrow for my word round. Now remember our different clinics. Mondays, Believing for Baby. Tuesday, Dr. Ndiche. Wednesday, Community Health Clinic. Thursday, Dr. Ndiche. Friday, like today for these Fridays. Tomorrow, my ward round. Sunday, my Maternal and Child Health Clinic. So there is no day you show up, you won't get something. And you didn't pay kobo, right? You didn't pay any money. God bless you and enjoy your weekend, my dear. Remember, you're beautiful. No matter what anybody tells you, you're beautiful. Don't let any idiot bully you. Don't let anybody pity you. Don't let anybody enter a relationship with you based on pity. No! Reclaim your standard. God bless you, my dear, and have a beautiful weekend. I love you guys. Bye-bye for now. Dr. Ndiche, you can hang around and see if you can provide feedbacks to the questions I didn't, provide feedbacks to. I love you guys. I'll see you guys tomorrow. God bless you, and bye-bye for now.